CNA Practice Test 2025 Legal Ethical Behaviors 25 Real Questions Answers Updated NEW. Question 1. Which position is best for resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's upright aids lung expansion. Question 2. How often should a resident be repositioned? Every 4 hours, once a shift, every 2 hours, once a day. Standard is every 2 hours to prevent pressure sores. Question 3. When a resident is on NTO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPVO means nothing by mouth. Question 4. Post-mortem care is for before surgery, after death, after birth, during sleep. Care given to a body after death. Question 5. What is a living will? A bank account, legal document about end-of-life care, a birth certificate, a list of belongings. Advance directive for medical wishes. Question 6. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 7. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 8. A resident wants to complain about care. You should tell them to be quiet, inform the nurse or ombudsman, ignore them, tell them they are wrong. Residents have a right to voice grievances. Question 9. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 10. A resident is angry and shouting. You should shout back, leave the room, stay calm and listen, call security immediately. Therapeutic communication involves staying calm. Question 11. The normal adult pulse rate is 40-60 bpm, 60-100 bpm, 100-120 bpm, 50-90 bpm. 60-100 bpm is the normal range. Question 12. A resident falls. What is your first action? Help them up, call for a nurse, move them to bed, give them water. The nurse must assess for injury before moving the resident. Question 13. When feeding a resident, you should rush them, offer small bites and wait, use a straw for everything, talk to other staff. Prevents choking and promotes dignity. Question 14. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 15. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 16. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 17. A resident refuses a bath. You should force them, respect their refusal and report it. Call their family, tell them they smell. Residents have the right to refuse treatment. Question 18. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap, below the bladder to prevent backflow/infection. Question 19. When dressing a resident with weakness on one side, dress weak side first, dress strong side first, dress both at once. It doesn't matter. Dress weak DW, and dress strong. Question 20. What is the best way to prevent the spread of infection? Wearing gloves, wearing a mask, hand washing, using antibiotics. Hand washing is the #1 way to prevent infection spread.